I want to zoom in and out from the clinical skeptical side to the hopefully, and I think we'll get to quite a few of these, but examples that could be corroborated in some fashion. And those may overlap with those that are described as out-of-body experiences. They might not. And we'll probably come back to that term as well. But could you tell the story of tell me if this is enough of a cue, the red MGB?
Yeah. Many people in a near-death experience say that they encountered deceased loved ones in the experience. And that can easily be explained as wishful thinking, expectation. You think you're dying and you would love to see your grandmother once more, so she comes to you. And there's no way to prove or disprove that. However, in some cases, the person having the near-death experience encounters someone who had died, but nobody yet knew they had died. So that can't be dismissed as expectation and wishful thinking. This is not a new phenomenon. Pliny the Elder wrote about a case like this in the 1st century AD, but we're hearing about a lot of them now. About 12 years ago, I wrote a paper that had 30 different cases from recent years. Jack was one of those. He had an experience, he was in South Africa back in the 70s, and he was a young technician at that time and had very serious pneumonia, and he repeatedly stopped breathing and had to be resuscitated. So he was admitted to the hospital with a severe pneumonia. And he had one nurse who was constantly working with him as his primary nurse, a young, pretty girl about his age. He flirted a lot with her when he could. And one day she told him she's going to be taking a long weekend off and there'd be other nurses substituting for her. So he wished her well and she went off. And over the weekend, while she was gone, he had another respiratory arrest where he couldn't breathe. He had to be resuscitated, and during that time, he had a near-death experience. And he told me that he was in this beautiful pastoral scene, and there, out of the woods, came his nurse, Anita, walking towards him. And he was stunned because he was in this different world. What's she doing there? So he said, what are you doing here? And she said, Jack, you can't stay here with me. I want you to go back. And I want you to find my parents and tell them that I love them very much, and I'm sorry I wrecked the red MGB. He didn't know what to make of that, but she turned around and went back into the woods, and then he woke up later in his hospital bed. Now, he tells me that back in the 70s, there were very few MGBs in South Africa, and he had never seen one. When the first nurse came into his room, he started to tell her about his experience, and seeing his nurse, Anita, she got very upset and ran out of the room. It turned out that she had taken the weekend off to celebrate her 21st birthday, and her parents had surprised her with a gift of a red MGB. She got very excited, hopped in the car and took off for a test drive, and crashed into a telephone pole and died instantly, just a few hours before his near-death experience. I don't see any way he could have known or wanted or expected her to have an accident and die. And certainly no way he could have known how she died, and yet he did. And we've got lots of other cases like this. They're called Peake and Darien cases, based on a book that was published in the 1800s with cases like these, where people encounter deceased individuals who were not known to be dead. Yeah, I don't know how to explain those.
Now, just to put my skeptic's hat on, I could say, well,
Sure.
if I were Jack, was it Jack? Let's just say it's Jack. That would make one hell of a story if there wasn't a third party to sort of independently verify it with.
Right.
But there are other cases, and for people listening, we're going to come back to some of the common questions, I would say, forms of discussion around these related to possible biological mechanisms or lack thereof. We're going to come back to that in a second. But there are then cases that are seemingly characteristically quite different and perhaps can be, and I'd be curious to know if this has been done or not, but verified with third parties. And one that comes to mind that I've heard you discuss is related to the surgeon flapping like a bird and I was hoping that you could give a description of that particular case study. Before we get to that, how many near-death experiences in terms of have you documented, studied, or otherwise read about, put into the archives yourself? How many instances would you say you have encountered in one way or another?
I've got slightly more than 1,000 in my database at the University of Virginia, where we have validated as much as we can that they were in fact close to death, and this is what happened to them. I've talked to many more people about their near-death experience that I haven't included because I wasn't confident that they really fit the criteria for being in the study.
Mm-hmm.
But it's really much more common than you might think it was, because people don't talk about these things.
Mm-hmm.
You mentioned people wanting the publicity of this. That may be more true now, but back in the 70s and 80s, nobody wanted to talk about these things.
Yeah, you see what I'm saying?
I mean, if you talk about things, you got ridiculed, you got referred to a psychiatrist, you were called crazy, you were shunned by people you knew, both materialists and religious folks. They didn't want to hear about these things. So people did not talk about these events.
What of this surgeon flapping like a bird?
Yeah. This was a fellow, Al, in his mid-50s, who was a van driver. And he was out on his rounds one day, and he had chest pain. And he knew enough to stop his rounds and drive to the emergency room. And they did some evaluations and found that he had 4 arteries to his heart that were blocked. And they rushed him to the emergency room for urgent quadruple bypass surgery. So he's lying on the table, fully unconscious, the drapes over him, so forth. And he tells me that in the middle of the operation, he rose up out of his body and looked down and saw the surgeons operating on him. And he saw the chief surgeon, who he hadn't met before, flapping his arms like he was trying to fly. And he demonstrated for me. At that point, I laughed. So I thought, this is obviously hallucination. Doctors don't do that. But he insisted that I check with the doctor. He said, this really happened. Ask him. So he told me lots of other things about his near-death experience, but that's the one that I was able to verify. So I talked to a surgeon who actually had been trained in Japan. And he said, well, yes, I did do that. I have a habit of letting my assistants start the procedure while I could put on my sterile gown and gloves and wash my hands and so forth. And then I go into the operating room and watch them for a while. And because I don't want to risk touching anything with my sterile hands now, I point things out to them with my elbows. And he pointed things out that just the way Al was saying he was trying to fly. I don't know any other doctor that's done that. I've been a doctor for more than 50 years now. I've never seen anyone do that. So it's kind of an idiosyncratic thing. Is there any way Al could have seen that? Well, he was totally anesthetized. He had his heart was open. I don't think there's any way he could have seen that. And yet he did.